Okay, well, good morning and welcome to the fourth and final outcome area working group meeting for health. A few housekeeping items before we begin. Next slide, please. Oh, actually, I'll go over the agenda first. So we will start with a welcome, housekeepings, as well as a summary of key takeaways from prior meetings and opening panels of our five very important and relevant panelists, a community discussion, public surveys, digital equity ecosystem mapping tool, and then next steps and close. So next slide, please. Okay. As for housekeeping, please select side-by-side speakers mode for best viewing experience, and visibility of our ASL interpreter will be spotlight throughout the entire meeting. Closed captioning is available if you choose CC closed caption on the bottom toolbar and select show subtitle. Please use the chat to introduce yourself at this time if you have not already. If you're comfortable, please tell us your pronouns, organization titles, where you're joining us from. And then lastly, when we get to the community discussion, please use the reactions button at the bottom of your screen, raise hand feature to be elevated up to the top so we can unmute you and call on you. So with that, I would like to go to the next slide. Cool. I would like to invite Latifa, one of our graduate student assistant who has been supporting the Health Outcome Area Working Group. Some of you have met her, but she will walk us through a few takeaways from the May meeting. Latifa?
Thank you very much, Anne, and good morning, everyone. Thank you for being here today. As Anne mentioned, I'll take you through the takeaways from our May meeting. So some of the takeaways from our discussion was we've seen projects where there are targeted advertising campaigns, and these have been very influential in maximizing the success of digital equity programs. Another thing is that internet access increases health information and service accessibility. We've also seen that devices larger than a phone sometimes may be necessary for effective healthcare services. Sometimes a mobile phone, while it may be helpful, there needs to be more than that needs to go into provision of the services. And lastly, telehealth offerings allow clinics to retain talented staff. So this does not only help patients to be able to access telehealth services, but it also helps them. It also helps them retain staff who are not able to maybe move locations, or who are not able to show up in the offices physically. Thank you. I'll take it back to you, Anne.
Thanks, Latifa. And then next slide, please. Okay. As you know, this is our last of our meeting series, but so we want to provide a few high-level summaries of what we've heard, right? We do recognize that there is a lot of conversation, and this may not capture everything we talked about, but these are the few common themes that we've seen across all of our health outcome area working group meetings. And the framework for them is essentially under access, affordability, and adoption. So the first one is poor connectivity when connecting to telehealth services, having to do with access. Limited access to devices sufficient for utilizing telehealth services, the overlap between access and affordability. Insufficient digital literacy among patients to effectively navigate online processes for telehealth, such as making appointments or verifying medication. And then the last is difficulty accessing online healthcare materials effectively and efficiently. Both 3 and 4 has to do with adoption. So those are a few common themes we saw in the past 5 months, for barriers to digital equity. Next slide, please. And in this discussion, we also hear recommended strategies from you all, and we want to make sure to summarize it here as well. So what we heard was support digital navigators capable of delivering training and digital literacy programs for telehealth services, provide ACP, affordable connectivity programs, and subsidize connectivity for Medi-Cal subscribers, share information and programs related to digital equity in healthcare among health-focused networks, and design educational programming for use of telehealth services. So let us know what you think about both the barriers and the recommended strategies in the chat, as well as the community discussion in a little bit. But before we get to that, I would like to introduce our panelists here who will talk to us and kick off our conversation, answering a few questions, right? The high-level questions that we ask them to address are what digital equity strategies or programs would be most useful to increasing health equity and outcomes? What barriers do they address? Like the three: access, affordability, adoption, digital literacy, etc. What are the gaps and opportunities in terms of partnerships and collaboration should we look at to close the digital divide and increase health equity? So with that, I would like to introduce Kelly Bradfield, Manager of Population Health at Covered California. And then please hand the mic back to me. We'll drop the slide, but we'll follow this order with Kelly, Mar, Christy, Kevin, and Marissa. Thank you so much, Kelly.
Hi there, everybody. I want to make sure folks can hear me. Perfect. I see some nods. Thank you. Thank you so much for having me. And this is actually my first meeting of this series, so I really appreciate the recap. And I will echo certainly some of what we have already talked about early in this meeting. So from Cover California's perspective, when we think of digital equity, we think of both access to our program generally, and also care delivery services. So our platform, Cover California for enrollment, is very much digitally based. So the idea that we're trying to make it easy for folks to come in and get healthcare information, financial aid information online is key to, I would say, business model almost, and that we do need, in order to be sustainable, we do need to be able to sell coverage to folks and also be able to provide folks with really easy access to the financial aid information that they can get and to get that affordable access. And then on the other side though, so we're trying to get coverage for as many people as possible through these really accessible digital tools like Shop and Compare, or being able to enroll online and choose their provider and also their plan online. But also we are thinking a lot about this on the back end of, once we have as many people having access to care as possible, do they actually have access to services? We have, of course, members in all areas of the state, and we hear a lot from our members about how hard it is to access care in rural areas, and also how hard it is to access even specialists in every area of the state. So when we think about this in our contract with carriers, and when we require telehealth for all services, including behavioral health care, we're trying to understand how we can not compound the inequity. So the idea that folks living in rural areas and maybe underserved generally also are underserved when we think about digital access. So these folks that we are trying to reach through telehealth, they are also these folks that this organization is trying to reach through digital equity. So when we think about using telehealth to sort of level the playing field, we're really looking at whether or not we would be doubling sort of the injustice, so to speak, because we're saying, don't worry, we can offer you telehealth even if you live in a rural area. But the folks that we're trying to reach actually are those that are exactly less likely to have access to digital to digital equity. And so it's sort of, it's a little bit counterproductive might be the wrong word, but not quite reaching the solution, not quite the solution that it could be. Telehealth is not quite the solution it could be if it were not for these underlying digital inequities. So when we think about that, then the strategies really do the strategies that really would be most helpful for us in reaching as many people as possible, it does really relate closely to access to the high-speed internet, of course, but anecdotally, what we're hearing after COVID is that even just access and reimbursement and payment structures that allow for phone appointments are very, very helpful, even as a bottom line versus video or other things that do require like the higher speed digital internet or other kinds of digital access. I will pause there and pass it back to you.
Thank you so much, Kelly, for sharing that, the gaps and the opportunities, and also recognizing that really access to broadband, right, is the health determinants. In prior meetings, we talked about how broadband and digital equity is essentially the health determinant of this century. So by focusing on that, and you'll hear later on how other folks will really mirror and reflect on that too. I do see questions here directly for. I was wondering if I can just ask that real quick. We can also save that for later, but is covered California doing outreach / enrollment to ACP, the Affordable Connectivity Program, and this is an essential aspect to healthcare. So I don't know if you want to take that.
Yeah, can I actually take that back? I don't know the answer offhand.
Yeah.
Thank you.
And Anne, I wanted to jump in here. Hi, everyone. I'm Scott Adams, the Deputy Director of Broadband and Digital Literacy. And so that's, part of the state's Broadband for All program, as Anne kind of teed up and as Latifa recapped, is about the digital equity. The critical components are access, adoption, or access, affordability, and adoption. And so part of the way that we've structured the digital equity planning process and the work groups are what digital inequities exist for covered populations, and then how do those impact disparate outcomes, and then what through creating digital equity, how do we create or improve outcomes in key policy areas like health access. And so part of this whole process has been to bring together folks within the healthcare community and others that are providing digital access as a means to get information, services, and care. And then what role can those entities play in helping to increase adoption rates? So for instance, promoting the Affordable Connectivity Plan and helping folks get connected to other low-cost service options. And so it's kind of a virtuous cycle where all of us are working together, knowing that there are connectivity gaps, but by no means do we want to perpetuate inequity by encouraging folks to put services online while leaving folks behind. It's kind of the converse. We're saying, how can we do both? How can we first, through the billions of investments and infrastructure that the state has put out there, and the massive statewide effort there is to get people to adopt, to continue to complete that cycle where it's the service providers that we're actually expanding equity through digital equity.
Thank you for the additional comments, Scott. And thank you, Kelly, for that as well. I would like to hand the mic next to Mar Velez from Latino Coalition for a Healthy California, Director of Policy, as well as her colleague Paula, Senior Program Manager. So let's make sure to spotlight both of them. The floor is yours.
Thank you, Anne. Thank you so much. Again, hello, good morning, Mar Velez with the Latino Coalition for a Healthy California. Just want to do a little bit of an introduction to who we are and the work that we do. So LCHC, we are a statewide health policy advocacy organization. our mission is to protect and advance the health of Latinx and Indigenous Californians in our state. And so with that brief introduction, I'm actually going to hand it off to my colleague Paola Ilescas, who will share about our community listening tour and what we learned about how the digital divide impacts Latinx and Indigenous Californians.
Thank you, Matt, and good morning, everybody. My name is Paola Ilesca, Senior Program Manager with Latino Coalition for Healthy California. And one of our projects under Programs Department is a listening tour, which takes place statewide all over California to really listen in on the priorities and the needs of the communities across California. We try to aim to listen in order to advance Latinx health, also along with the tour. And one of the priorities that came about was a digital access and equity and broadband accessibility. And at LCHC, we believe that this is part and it is a social determinant of health. Some of the regions that elevated this was Orange County, Inland Region, San Diego, and Central Coast. And we do have a summary of those listening sessions in these informational one-pagers that I'll share in the chat on our website under community data. And you'll see that there's a demographic sheet that's just a general sheet. And then the other one-pagers are more specific to the different regions where the listening tour was conducted. I do want to preface that our participants were mainly promotores, promotoras, community health workers. As we know, they are trusted messengers of the community and are key liaisons to resources, including digital resources like the ACP. So really just honing in on what are some of these topics that were brought about from Orange County and San Diego. A lot of the families and individuals there express that digital inequity caused so much stress on families to the point where school-aged children experience stress and also burden on their mental health, even affecting their academic performance. And of course, on top of that, families found it really difficult to afford internet services, which is another additional cost to already an expensive cost of living specifically in San Diego, but also in Orange County. Many families also relied as smartphones being their only device, and meaning that laptops or tablets were just too expensive, and students sometimes had to rely on other borrowed devices or even just smartphones themselves that didn't offer all of the features that a laptop or a tablet would to really enhance that learning experience. And then I'm going to pass it over to Mar to explain what the Inland Region really expressed around this topic. Mar?
Yeah, thank you, Pao. So in the Inland Region, we heard from participants about the digital access challenges for multi-family households. So due to the high cost of living in the area and internet affordability as well, multiple families have had to share one router in one household, making it difficult to access quality internet. So that's clearly an issue that a lot of families who are already burdened with high cost of living and then having to dish out, the cost to afford internet was clearly an issue. I'll hand it back to Pao.
Thank you, Mar. Yes, and finally in Central Coast, so we're seeing, right, that it's not just one region, but so many regions across California, but specifically in Central Coast with the promotores that were part of this group. Many of them are part of Mesoamerican indigenous communities that are mainly in the labor sector of farm workers. So a lot of them expressed that even though some services were in English or even Spanish, it was still very difficult to navigate these services or access them, given that there is a high need for Indigenous language access and interpretation. Again, also the cost of living, very expensive and very difficult to afford another bill of internet for families to afford for their school-aged children. So again, many families had to share even one router in a multi-family household, and kids would have to share devices, would have to share that router and have to experience difficulties in their academic learning experience. So definitely older children took a huge role to support their family members, to support their younger siblings or younger family members. in navigating these school learning experiences. And then just wanted to quickly share that along with this listening tour, right, we also have other programs, including Pasa la Voz, which is, it is a virtual charla, pláticas, or conversations, as we like to call them, where we share resources with the community at hand, and we work closely with trusted key messengers in different regions. And I'll share our Facebook page in the chat, but we're also doing pursuing other endeavors, which Matt will share more about.
Yeah, thank you, Pao. So just to add on to what Paula shared, clearly there is a need to just bring more awareness to the issue, specifically around Indigenous language access. And I'd like to do a small plug in here that we are actually working on a bill, a legislative vehicle, SB 435, for the state to start collecting and disaggregating data for Latinx and Indigenous Mesoamericans in California, which is really exciting. So definitely we can share more in the chat around our bill. But the bottom line is that Latinx and Indigenous Mesoamerican communities experience affordability, quality, and access challenges when it comes to internet access, which then impacts livelihoods, education outcomes, and ultimately health and quality of life. So in terms of solutions, we totally support digital navigators, and as Pao shared, promotoras de salud who can assist in navigating online telehealth in language and in culture. And at minimum, we obviously need low cost and quality broadband for these communities as well. So thank you so much for your time.
Thank you. Thank you both for your time and really giving a unique experience summary of each of the region you had conversation with, but also allowing us to see the common themes, right? Like the ties together all and the experience of Latino communities in these regions. So I appreciate you for your work, and also looking forward to continued collaborations. Next, I would like to invite Christy to, there you are. Christy is the CEO and founder of Healthy Rural California. We're glad to have met you in Chico. Christy, and thank you for joining us today.
Thank you so much for having me speak a little bit on what we're doing. Healthy Rural California is a relatively new nonprofit organization. We just got launched in 2020. And part of the reason that we came to fruition was because in 2019, the region was recovering from the Camp Fire. And we counted that 50 to 60 physicians had left the area because of the fire in an already chronic access to care region. And so we launched also an effort to bring more doctors to the area through graduate medical education. I'm really pleased to report that as of February, we received accreditation for a new psychiatry residency, and our first cohort will join us next year. And we're also in the process of establishing a family medicine residency with the first cohort to start in 2025. Additional graduate medical education programs are being discussed right now with Enloe Medical Center here in Chico, as well as 2 regional campuses that will bring about 20 to 25 medical students to this area. So that's all new. So if you think about the map of Northern California, there is no medical school north of Sacramento all the way into the middle of Oregon. So we're really excited to be bringing medical education pathways to the area. The previous speakers gave great descriptions about how access to healthcare is limited when you don't have digital equity. And so we are hopeful that by increasing the number of providers here, that increasing connectivity can also work hand in hand. One of the things with the psychiatry residency is that we're going to have 16 residents. They're spending 4 years in this curriculum here in Chico. And so we're looking at projects such as Project Echo, which would connect the psychiatry residents with folks in communities that aren't necessarily right here in Chico where it's easy to come in person. We have a partnership with Stanford University. They're using the ECHO program right now with the Two Feathers tribe. And we're hopeful to replicate and partner with Stanford on that program as well. Of course, then digital connectivity would be really important. And then one of the other things, we're sort of in this healthcare workforce space and getting a bigger regional footprint. We just started a healthcare pathways program. It's 8 weeks of an internship that's both nursing and medicine, sort of getting some clinical connections for these future nurses and doctors, but as well providing them with the resources to pursue nursing and medicine education and future careers. And so part of that is developing a connection with the schools in the region. And that would be for delivering a medical club to middle and high schools so that students anywhere in this region could access the information, sort of connect the teachers who are really strong and passionate about helping, encouraging youth to pursue medicine and nursing. And so that would also be another digital connectivity that would, get us into all 10 plus counties up here that we now represent. I think that sums up. We're basically building a medical school, which is a whole thing and a long-range plan, but we're taking those steps through graduate medical education, then undergraduate medical education, connecting, of course, with the Chico State Pre-Med program, as well as encouraging more nurses to get out of the clinic and then teach the future generation of nurses.
Thank you, Christy. That's incredible. My fiance is in a psychiatry residence, so just hearing that there's more programs to be in the state, I think that really is creating that pathways. And for you to think about how digital access is a part of that way, I think that's very innovative and definitely speak to the recognition of the gap and also the creative opportunity that exists in the northern 10 counties of California. So
thank you.
Thank you. So next I would like to invite Kevin Shimamoto. He's a VP and advisor to the CIO of Valley Children's Healthcare to the spotlight. Kevin.
Oh, thank you, Anne. Kevin Shimamoto here. I have been the CIO at Valley Children's Hospital, Central California, for about 9 years. Recently, I've put on a new role as an advisor to the CIO as well as special projects. Over the last 3 years post-pandemic, we had a lot of pediatric children who are not getting the availability to come into the hospital to get health care. And what we found out over the time is that access to our portal, access to healthcare remotely was a challenge. And we really found out real quickly that people did not have access, they didn't have broadband, they didn't have literacy of understanding how to even connect their cell phones to our portal. But so what we did, we actually reached out to many organizations along the 99 corridor. So we represent about 1.3 million patients or kids in the San Joaquin Valley, as from Bakersfield, just under Sacramento area. And some of the things that we're trying to do is have accessibility for them. So we reached out and put together a coalition, and the Coalition for Digital Health Equity in the San Joaquin Valley was formed. And from that point, we are looking for, organizations along this corridor to be part of this huge broadband, for all program that's going on at state level. So it's, so we have about 18 members, and we're always looking for more to help understand what we're trying to achieve, because it's in many other facilities. It's not just pediatrics, but it's in the, geriatrics, the adult care facilities, the FQHCs, the rural health clinics, but it's definitely trying to get a message out that we need advocacy, as well as have people to understand just what our mission is and not be afraid to do a connection. So a lot of things that have already been mentioned, I won't go into it in details, but our 3 priorities that we're trying to achieve is access to broadband, literacy, and the policies that go along to make sure this happens. So I'll take one real quick one here. It's on the literacy program. We are working with Fresno State with Eduardo Gonzalez on their literacy program. I think they have 5 different languages to actually, for free, teach family members about how they can access their portals, just how to utilize the cell phone and put programs on the internet that has healthcare related types of needs, as well as schools. So that's one of the things that we're trying to do over the next 3 to 5 years, is to build a program for healthcare and make sure that those outlying areas have the ability, utilizing what we're trying to get is the broadband for all, to get everybody connected. And I'd be more than happy to talk to any of the organizations, and I love to see that we can combine a lot of that same efforts so we can take it to the state level for them to realize that healthcare is a need, and there are mappings and gaps and things all that everyone has been talking about in its reality. So I'll stop there.
Thank you, Kevin. And I think you reiterate a very important theme that we heard as well throughout the past few meetings, is the connections and partnership. Definitely, we can't do this alone. Any entities cannot do this alone, and partnerships on multi-level, right, is needed to reconnect all levels of the community members. So thank you for sharing that and sharing the work that your coalition is doing in the San Joaquin Valley. Next, I would like to introduce Marissa from Insure the Uninsured Project, who is one of our cultures that have been very supportive throughout our engagement process of the State Digital Equity Plan. Marissa.
Thanks, Anne. And thanks again for having us speak. For those of you who don't know me, my name is Marissa Montano. I'm ITUP, or Insure the Uninsured Project Director of Policy. So we've been working closely with CDT and have been speaking on a lot of these events. But for, ITUP is a over 25-year-old health policy expert and convener. And Anne asked me to come and share some insights that we've had from recently. Leaning into our convener role, we hosted in April a broadband boot camp event that featured both a training session on broadband, like everything from holding fiber to how does broadband impact healthcare, what does the data say, what data do we need, all of that, but then also dug into having some really good brainstorming workshops to, not only identify what the barriers to healthcare that many of the panelists before me had all highlighted, but then also drilling into what are the solutions that fit the needs of California communities, and like what are some creative ways that we could leverage the digital equity plan to provide support for those solutions. So as a little bit, and my colleague Shirley already shared in the chat, the report that we published that details a lot of what we heard in these workshops. But as sort of a high level, we had 3 different buckets, and many of them are themes that you've heard. And Kevin, who spoke before me, was one of our esteemed participants of the day and is a great partner with ITUP. And the coalition that Kevin talked about is really outstanding and amazing, and could, the more people that engage in that way, in power in numbers. But to highlight some of the findings from the workshop, there is a huge need for digital literacy programs that are tailored and specific for healthcare, navigating telehealth, navigating health insurance enrollment forms that are online, navigating and having inclusivity with different languages. And so some of the supports that the digital equity plan can provide for that need identified were investments in a statewide training for not only for patients, but also for providers, all different types of providers, to engage in telehealth technology, anything virtual that can create better health outcomes and make the healthcare delivery system more accessible and equitable. Also funding to support the development of those language-specific support and services to make telehealth more efficient and effective and accessible to those that don't speak English, which is a lot of our California communities prefer a different language, and our healthcare delivery system should support that. The second big need was data. We need to be able to identify which of our patients in California are, might prefer telehealth, but might forgo care altogether or choose in person because of the digital barriers to health. So identifying that, plus what are those digital barriers to health, and can we connect folks to services? Some of the solutions identified that the digital equity plan could support included, allocating funding for some data collection pilots. How can we leverage our healthcare data systems, our intake forms, data exchange to identify the patient's needs and then connect them to support and services that might be available to them. And then the final, and this is a big one, and I kind of want to underscore that, like healthcare is local, digital equity solutions really need to be local. And there's there's a need for outreach and engagement and support for that outreach and engagement to make sure that there are local solutions and community voices uplifting the digital equity solutions that we need to truly close the digital divide. And that could look like anything from allocation of funding for a technical assistance marketplace that community-based organizations or community members can access to find support and services around digital literacy devices, internet affordability, affordable connectivity programs being one of them, and so on. Another would be, support to create whatever educational materials or bridging the gap kind of materials that are needed for our local leaders to continue the advocacy and engage in a big way to make sure that the state investments in digital equity, including the digital equity plan, can support an accessible and equitable healthcare delivery system. So I'll, before I hand the mic back over to Anne, I mentioned the report is public. ITELP has been working on this issue for the better part of the last 3 years, and I'd love to connect. I see some new names and faces and that we're introducing each other in the chat and my fellow panelists. We'd love to engage and create some momentum here to make sure that healthcare solutions are included. We also last week released an issue brief that, that in part highlights, healthcare stakeholders and what are the different roles and descriptions of those roles and ways to engage in those roles for having a shared responsibility in addressing the digital divide and advancing digital equity. And pairing with that, we held a policy forum last week, a webinar that resource, the webinar and all of the tons of resources that were shared during that webinar are all available on our website if you missed it. But if anyone wants to connect further, I'll put my email in the chat. And thank you again, Anne and CDT and all the panelists for all of your work in this week. Thank you.
Thanks so much, Marissa. I think you really hit the nail on the head there in terms of how these working groups have been a way for us to create synergy and community really around this topic and this issue. As Kevin said, like the Broadband Coalition has been working in San Joaquin, but it's really adding in the health perspective to it and being able to connect folks from, up north, like far Northern California to south of San Diego in these spaces. So love the work that all of you are doing and the ideas that are coming out from these sessions. So please stay in communication, in community, and I think this is only the beginning of our work together. So, and with that, can we bring back these slides? And as my colleagues doing, I just want to thank you all to all of our panelists, speakers so far for sharing your work. And I know it's not easy to take time out of your day, but thank you for that. All right, next slide, please. In the community discussion and recommended strategies portion, we have a few prompts to start the conversation, but I definitely am going over the chat too to make sure I'm not missing any questions for you. Panelists, if you see questions for you in the chat, feel free to go off mic and respond. Like hopefully this portion is a very much a bi-directional conversation. Of course, there's still some sort of organization so that we're not speaking over each other, but if you in the group, if you would like to answer any of these three questions in no particular order, feel free to use the reaction and raise your hand function, and we'll be able to elevate you. I see Leticia. Go for it.
Hi, good morning, everyone, and thank you again for convening us. And thank you to the presenters. You guys all presented some really great work. Great to hear how you're working on digital equity. Would love to partner with each and every one of you that, if we're not already partnering with you, we partner with ITUP and others. So just look forward to hearing more about your work and reading your websites. I'm sorry, of course, of all times, my gardener's here. So you're going to be hearing the lawnmower in the background. So sorry about that. But that's can be predicted, right? Either that or my dog starts to bark. So in any case, there's a couple of things. One is particularly with our colleagues at LCHC, a great presentation, particularly around navigators and promotoras. And we've had the good fortune to receive a grant from the Kaiser Permanente group. And we have been working with Latinas Contra Cancer in San Jose. And this project is focused on not only it's building up, training up promotoras to 10 promotoras to do outreach for the Affordable Connectivity Program. That's one aspect of their work. The second aspect of their work is to provide digital literacy to those households that they enroll in ACP. And the third part of that is they also are providing telehealth literacy. And it's amazing the work that they've been able to complete. Now, it's also important to note that because people come from the community, that just like everyday life, things happen. So, you know, some have had health struggles, some have had, so there is some of that will need to be dealt with, but just the access that they have to communities are so important. So I guess one of the questions that I have is, you know, how can we effectively and seamlessly integrate these promotoras into digital navigator discussions and planning? So I don't know if there's anybody on this call that can answer that, but I just want to give a shout out again to the LCHC folks and the work that they're doing, and because I do believe that, and I think Marisa, you mentioned it, that you know it's really about being local, and we do have to work with folks who are trusted messengers, and the promotores in general. Do a great job. Like I told you, my dog was going to start barking. So in any case, I'm going to stop there, but if anyone on this call can answer that question, that would be great. Thank you.
Thank you. I think Mar has her hand up.
Yeah, thank you so much, Leticia, for that question. I think, you know, you're pointing out some really important things here about the Promotora CHW workforce. As much as they bring, I mean, they are such a health equity solution. That's why they're so effective. But that's one of the challenges as well. I think that some of these promotoras, some of our community health workers are facing the exact same challenges that our communities are facing, right? And so how can we build their capacity, one, and then two, how can we make it sustainable for them to continue doing this work? I think the state of California has recognized how effective this workforce is. That's why there's the new Medi-Cal benefit, right, within our state that is now available, where if you are a Medi-Cal recipient, you do have the ability to access CHW services, which is excellent. part of that as well is the certification program that the state is also developing, and we've been a part of that process. Navigation services is absolutely one of the skills that, you know, our promotoras are going to be offering through that benefit. But again, we need to provide them with workforce development opportunities, with consistent training, with equitable wages, right? You can't help others until you help yourself. Absolutely. And so, you know, want to definitely connect with you on how we can maybe make digital literacy, you know, a very much a core part of all of the skills that they're getting trained up on, et cetera. And I see my colleague Paula, and so I'll hand it over to her really quickly.
Sorry, I was trying to find the mute, but I did see Scott had their hand first. Scott, did you want to add something?
Why don't I follow up after you?
Okay,
'Cause I
sounds
think you're
good.
gonna- yeah.
Thank you. Thank you. Yeah, I just wanted to add really quick that it also takes a lot of integration and planning with and side by side with CHWs, which is the abbreviated term, right, for community health workers, promotoras, or also known as representatives. Since the inception of planning, right, it really takes that type of integration and really involvement at that level with promotoras, because they will know and they will point out, right, what are the needs, which methods, what ways are the best to reach community at hand, right? I'll give a solid example with actually one of my previous jobs at a local clinic that we had to reach farm workers in rural areas where there's no even cell phone coverage, right? So it really took for us to go out there, right? And promotoras that were in that region will let us know what would help is bringing the clinic here. What would help is bringing the doctors here. And so what was happening was we were setting up annual type of health fairs, right? And also then setting up transportation routes. Really working with clinic, having that buy-in from the clinic, right? Making the case that we do need to invest in vans, we need to invest in routes, in up-to-date right type of vans, where we need to invest in capacity training with promotoras, with liaisons, as they go to pick them up from their their agricultural work site and bringing them to the clinic, right? What could happen also between those points, right? Setting them up, helping them out, tailoring these services to them. So really having doctors even dedicated, right, time slots for folks that are the hardest to reach, which our population was farm workers. So we had to dedicate time slots with doctors for their appointments at a later time, right? So those are just some brief examples on how we adapted that. Thank you.
Thank you for sharing and really going into detail about the wraparound service that's needed to deliver healthcare to folks. I see a hand, I think Wendy, if I think we saw or heard from you before, so I'm guessing your name, but go ahead and.
Yes, it's Wendy.
Oh, hi there.
Thanks for calling on me. So I think a way that I would like to see done is I come from the support group world, and I wonder, you know, in order to have continuing dialogue about what is needed, is I wonder whether we can have some kind of capacity, you know, a prototype and capacity building for, and just call it something like technology support group, where people can either drop in once or have continuing discussion so that we can actually find out what people are needing and what people know, and can help each other, and have it funded in some way, and then maybe replicated in different communities throughout the state, and stuff like that. That's an idea that I just came up with.
Thank you, Wendy. And I think you speak to the local communities group, right? The local support and strategies that both Marissa and the folks at LCHC highlighted in terms of how to make sure these strategies target the communities within certain regions and their needs. So definitely relevant, and thank you for sharing. I want to make sure we're not missing any questions in the chat. My team, or if anyone has any trouble raising their hands, you can just wave at me too, and we'll find you in this camera, in this box. Would any of the panelists like to address any questions that were raised to them or to the group in the chat? Just want to make sure. I'm reading it now, but we can do this together. I think, Kevin, someone asked you about how to reach you or the coalition. If you don't mind just going off mute to address that really quickly.
Yeah, real quickly, you can reach out to me at kshimamoto@valleychildrens.org, and I'm putting that in as we speak so that everyone will have that address to contact me. There it is. I've got that out there right now. Just post that.
Mm-hmm. And thank you, Catherine. I do see a hand. Go for it.
Hi, and I'm Sharan. I'm the head of public health at a social impact organization called CellEd. I just want to add to what everybody else has been saying, and in our work with frontline community workers, including promotores, we've noticed that these workers are already quite stretched and overworked and have limited capacity. So whatever we do to build their capacity, it has to be aligned with their availability and makes it really easy for them to actually learn and utilize whatever it is that we are presenting to them. So really looking at opportunity costs for some of our partners and some of our frontline workers, where every time we ask them to take a training or do something extra, they have to say no to something else. That is also quite critical, right? So how do we make it available in a form that's very easy for them to absorb and to participate in? And one of the things that I would like to share as a strategy is utilizing micro lessons as opposed to multiple day trainings, either in person or online, which requires them to either travel or have access to a laptop, internet, and then expect them to take time away from the other work. If we can deliver a lot of digital literacy content and build their capacity using micro lessons that are 3 to 5 minutes long and delivered in a form that is easily palatable for them. So as opposed to saying, requiring them to utilize a high fidelity device or connection, delivering a lot of this content via text and maybe even via voice probably is going to work better for them. And they are probably going to utilize it more than expecting them to spend hours and hours in outside trainings. The second part around the strategy that I would like to share to the group is also making sure that there is somebody, there's a warm body that can actually support them in their process, because there are two things we can do, right? One is we can provide trainings which are standardized and we can deliver them. But when they are in the field and they're actually communicating and talking to our end users, the last mile communities, often questions will come up that may not have been addressed or they might not recall the answer to. So how can we make sure that we have some tool for them to utilize in the field where they can immediately actually pull it out and find the answer to that question? And that could be a chatbot, that could be a list of frequently asked questions that is easily available to them. The third part is, because our communities in California speak so many languages, whatever we do to build the capacity of our workforce to deliver digital equity training and literacy trainings, has to be multiple languages, right? Other people before me have said that, right? That is going to be really quite crucial. So not just making it available in English, definitely Spanish, definitely many other languages that our communities speak and are most familiar with and are most likely to participate if we deliver content and literacy in those languages. And then finally, somebody that they can talk to, like a coach or a, an expert in digital information, who can actually pick up a phone and support them in their journey for acquiring these digital assets and utilizing them, answering their questions. If they hit a wall, the ability to ask those questions and get those questions answered quickly in a warm, compassionate manner. I feel that those are some of the strategies that I just want to present. And I recognize these are aligned with a lot of things that other folks have said, but just wanted to paraphrase and add to what other people were also saying. So thank you so much.
Thank you. Thank you for adding to the conversation and giving very concrete strategies to do so. And I see Sandy having a question in the chat. Would you be able to come off mute to kind of elaborate on your question?
Yeah, sure thing. My question is, this is, and apologies, I'm maybe a little late to the party from some of the other sessions where maybe this was addressed. But I'm just thinking, this is the health focused session, but I'm just thinking how these initiatives that are going to enable better access to telehealth and things like that. How I feel like whenever in health we get focused on healthcare delivery, and I'm just trying to, I guess, think of ways that these initiatives can support addressing some social determinants of health. So things like upward mobility in, say, rural areas, for example, where there's not as many high-paying jobs that might now be accessible through remote work, or things like access to higher education or anything like that.
I'm so glad you brought it up, because we definitely don't work in a silo when it comes to digital equity planning. This is the health session, but throughout the week, we actually had education on Tuesday, and then our workforce development yesterday, and then essential services later this afternoon. So I think we have a focus to each working group, but in terms of the strategies, they do overlap and able to address the points that you talked about. How do we increase workforce in rural area or in regions to help people with upward mobility? It does lead to better health outcomes, right? So I think we're definitely aware of that. And so I'm not sure how we're doing on time, but I think, Scott, would you like to add comments to what have been shared?
Well, Anne, I think you covered it. I just, for Sandy, the whole series of workshops is part of the Broadband for All program, and the state's Broadband for All program is really focused on that access, affordability, and adoption are critical for digital equity throughout the state. And what we had teed up is the state has already allocated about $6.5 billion in the last couple of years for the physical infrastructure to develop an open access middle mile network, a number of grant programs up to $2 billion to fund last mile network solutions in rural counties. And then we've had this massive mobilization throughout the state to increase enrollment in the Affordable Connectivity Program. And then what we're doing now is that this broader planning that we're doing is, how are we going to create the next chapter of Broadband for All? The digital equity plan we're developing is really required so we can get up to $100 million from the federal government to implement the plan. And so eligible uses are things like broadband adoption programs, digital literacy training, digital navigation, workforce development. And so this is part of a much broader sweeping effort that we've been conducting over the last several months, where we've convened with over 6,000 residents and community partners, both online and out in the communities, to answer that very basic question, that there are the most vulnerable among us that are impacted by the digital divide. And, you know, how does that inequity impact outcomes in the key areas that Anne kind of outlined? So education, health, workforce development, access to essential services, digital literacy and inclusion, and then a very dedicated effort about travel collaboration for our travel partners. So it does all come together. And what we're seeing is a convergence of themes here around what all the speakers have said, that if you don't have access, if you don't have service, if you don't have a device, or you're not trained, none of the outcomes in health or education are possible. And that's the chief aim of this group and this effort. And the strategies that you all have recommended is, how do we spend capacity dollars to overcome the barriers of mistrust in government and private companies, to empower trusted messengers, to do outreach campaigns about the importance of adoption, or partner with folks like promotoras or health navigators, or even IHSS workers potentially, to do digital navigation in this health space. So just kind of wrapping it together. And I think that it was such a great question, in that this panel has just been so powerful, and that it identifies both the common barriers and a lot of common strategies that have been recommended throughout the different working groups, but the very specific and unique problems in the healthcare space about you know, that the panelists have discussed. So that's just what I wanted to add there.
And Curtis, I saw that your hand has been up.
Yeah, I have a question, because there's an upcoming slide, and yesterday it was just up and gone so quickly, and no discussion. So I'm going to ask it, and then when you get to it, you can. So there's a slide that, with regard to the survey that's going on out, the individual survey, and there was a number there that really stood out, and someone has been very active. It was a number of surveys completed in Chinese. So I just a number far exceeding what one would have expected at this stage. So anyway, you may not even be aware of where that came from, but anyway, just want to have you comment on that when you get to that slide.
Thank you so much. And I think you're helping us transition to the next slide. So it's a perfect comment, and we can definitely address it when we're presenting that slide as well. So yeah, I don't see any more hands, and thanks for folks in the chat as well. If I'm missing anything, we can definitely come back to it. But want to give Sean the amount of time to talk through the digital equity survey. Go for it, Sean.
Thanks, Anne. And thanks everybody for participating today. My name is Sean Doherty. I'm with the Broadband Equity Partnership, and I'm thrilled to be able to demo actually for you 2 surveys that are currently active and ongoing. The first one will be this digital equity survey for individuals and households. The second will be the DEEM, the digital equity ecosystem mapping tool for organizations. And you know, these are just other means of us collecting information on the digital equity needs of the state, in addition to, you know, the 17 in-person workshops we've had, and all of these great data and, you know, and recommendations received from these working group sessions. So all of this great data is just going to be compiled into our state digital equity plan and just make it all that much stronger. So if we can move on to the next slide. So the digital equity slide, as I mentioned, this is for individuals and households. I'm hoping everybody on this call has completed it, and if not, will complete it. We put a lot of time and attention into making it really accessible to the broadest population possible. You see that QR code on the screen right now. If you have a smartphone, I would encourage you to actually scan it. You will see that it pops up on your phone, and it's, you know, mobile friendly, it's mobile reactive, it's very clear on your cell phone. system. So it has been, really, I think, enhanced to be completed on a mobile device. It's available in 14 languages. It has built-in audio and visual functionality. And actually, Mel, why don't we bring up the demo and I'll just show individuals how it works and how just clear it is as I kind of talk and walk through it. So this would be, kind of the call to action in this, with this online household survey is for, everyone on this call to share it with the communities that they serve. We want to hear from the prematuras and those who are engaging in community. Christy, we would love to hear from your medical students and your, the medical, the residents, what is their experience with broadband in the community? And as you can see, Mel is just demonstrating some of the functionality, the ease by which it moves through all of those 14 languages. Down at the bottom corner, you can see it's got a little play functionality that every single page of the survey can be read aloud. Again, that is for people who may have a limited literacy in certain languages or limited vision, really to make it, as we mentioned, as easy and accessible for the broadest population. Kind of the minimum standard to complete the survey is, are you 18 and do you reside in California? And after that, we really want to collect information on where do you reside? Do you represent or are you part of one of the covered populations? That's just really important that we've gathered more information on. And then, we ask questions about, do you have access to broadband? If so, is it affordable for you or is it a burden? Why don't you have broadband? If you don't, again, is it lack of access? We know there's a large portion of the state that doesn't even have access to broadband. Or do you not have a device, or do you not feel comfortable using a device? And this is just really critical information for us to gather and collect, and that again will be put into that the state digital equity plan. And as I mentioned earlier, this is mobile reactive. So Mark, I saw in the chat that you have a really great mobile program and that you've been able to be really successful in ACP reach out with the community that you work with. So if you were to send a link and they were to click on it, it'll pop right up on that screen. So and we have kind of proof that this survey is working. So Mel, if we can actually go back to the slide presentation, I just want to show you some outcomes of the survey to date. Yes. And so as you can see, the survey's been out for about 3 weeks, roughly. We have almost 5,800 responses, and that's an increase of almost 1,000 from yesterday. So as we are working, with these outreach, as we're holding these working group calls, thank you. You are reaching out to the community. We are getting more responses from engaging with you, and and we are incredibly thankful. We want at least 10,000. I think in a state with 40 million, 10,000 should be reachable, and this will be open through at least June 30th. And a couple of things I want to highlight on this map is, you have Los Angeles and San Francisco, obviously high population areas, but then you have Imperial, Inyo, Tuolumne, some more rural areas, and they have really high response rates. So if you happen to see your county in there, please let's, if we can all work together to get those numbers up. And actually this next slide is going to address your question, Curtis, about as you can see there on the left-hand side for me, the use by 13 of those 14 languages have been utilized. And as Curtis mentioned, we're at 9% through have been utilized in Chinese, Spanish, English at 84%. And then again, that the chart there is showing those covered populations that we really want to hear from. So we love, we want to hear from the rural communities. We want to hear from the immigrant experience. And so, again, we have 5,800 responses to date. About 70% of people who click on or access the survey complete it. So we hope, again, that showcases just the ease and functionality of all of it. And Scott, anything to add? I think we're really proud of how the survey is going so far, but always can do better, right?
Well, absolutely. And so what I think the biggest challenge for us is we were questioning whether or not the survey was going to work, but given the translation into the 14 different languages, we would like to do, more and potentially do that next year. But the survey's working. We're seeing massive responses from, well, not massive, but significant responses from rural areas. So the mobile phone functionality is working. I think the numbers on the left show that the language accessibility is working. And so Curtis, your question about, we are too kind of surprised at the combined response rate in both the simplified and traditional Chinese. And there's two things that I can say is folks within the San Francisco Tech Council and the San Francisco community have been doing a lot of work within the Chinese population in San Francisco and have been doing survey parties or going around with the survey on laptops, and that's what's yielding a large response in Chinese. Additionally, we've created a toolkit. We do know that within the Chinese community, like there's been some like a buzz on WeChat, which is a popular app that has been promoting turnout as well. And so those are some interesting, anecdotes. The one thing that I would want to point out here is that this survey really is the opportunity to bring the voices of the folks that aren't at this table or who haven't been in the other virtual meetings or even the regional workshops. And rural communities, you can see the rural county representatives of California have done direct outreach to each of their counties and issued a challenge to get 250 to 500 responses from each county. And that's really, I think, what we're hoping to do. We want this plan to be, the digital equity plan, to be informed by the best data, both qualitative and quantitative as possible. So really a call to action to you all who have large networks of trusted messenger CBOs who, or even direct lists to individual residents, clients, customers to promote it out. And, I think Sean's going to go over, we've got a toolkit with a lot of different assets of, pre-drafted communications and social media assets in different languages. But I think that's it, Sean. I'll kick it back to you.
Great. Yes. And we will definitely show you where you can get some already made social media and outreach material to make hopefully this work a lot less burdensome for you. And with that, and I also wanted to say, sometimes I think you don't forget to think of your own employees and the people who work within your organization. So if you share that internally as well, those are responses that we really want for this individual survey as well. So, but I think we can move on to the next slide. And I'm going to move on to talking about our DEAM tool, our digital equity ecosystem mapping tool. And this survey is to be completed by organizations who are working or who would like to work in the digital equity space. So with that, that to me has a broad meaning. So is it nonprofits? Is it religious organizations? Is it libraries? Is it CBOs? Is it community health centers? There are so many organizations throughout the state that are doing this work already. And we really want to, someone mentioned this on a working group the other day, find those pockets of excellence. We really want to hear about all the great programs that are working across the state. And again, how about we bring the slide up now to kind of demo this tool as well. And again, as I mentioned, this is for organizations, kind of who should take part right there in the middle. Think really creatively about who you work with. Kevin, can you send this to all of your consortial members, or the partnerships, you have with Fresno? Marissa, maybe that's sending it to people who participated in your broadband boot camp. So they, at an organizational level, can complete the DEAM tool. And again, at a personal level, they can complete the public survey. But back up there at the corner, at the top, this is offered in English and in Spanish. And again, easily toggling creates that nice reactivity. Moving on, if you want to hit next, great. Just some basic information, demographics, about your organization, who you are, where you work, where you're headquartered. And if you want to scroll down just a little bit further for me, Mel. Yeah, so do you work with any of the covered populations? That's really important information for us to know. And then the next kind of categories of how you would describe your entity, please complete that for yourself. But as you're thinking about maybe who you could share it with, this is kind of a good guide. Like, oh yes, I do work with a community college, or I work with a workforce development organization that maybe you're not thinking about right away, but kind of reviewing this list, I bet you would be, surprised at maybe tenfold the organizations that you work with and partner with and collaborate with on this work. So again, very clear, very easy to see. For this one section here about, what types of programs you offer, whether it's device access or digital skills training, when you click on those, it'll ask you for some more details about that information. And we have a kind of a cheat sheet in the toolkit, which I will show you. But at the very end of this survey, you kind of on that last page, it allows you to add reports. If you have, an annual report right here, thank you, Mel. If you have white papers, if you have data sets or research you did in conjunction with a local university, please add those here. Just all that data will make it even more powerful. So just a place here at the end to add all of that additional resources. If maybe one of the questions didn't fit exactly the parameter. So why don't we go back to the slideshow, and we can again just show you some data and some statistics on the results that we're getting from this DEEM tool already. Sorry if it's a little bit of back and forth, but as you can see, a total of over 300 responses. Heat map here showing, kind of the number of responses received by county. At a bare minimum, really the floor we're setting is one response per county. We know more than one organizations work in and serve communities. So if you are, represent or you work in one of those counties, or of an organization that does, we're really urging you to complete this survey. We really want to have as complete a map of all the assets that exist in the state, again, that will be compiled into the state digital equity plan. And with that, we can go to the next slide. And this is one area, where I asked, the survey asked, how would you identify yourself? This is one that we kind of wanted to point out. Obviously, there's a lot more than 42 counties. There's way more than 22 city governments. So, kind of a specific call to action would be to reach out to some of these partners, the government or public partners. I would rather, a mayor's office hear from 5 different organizations requesting that they complete the survey than not hear at all. So I think it's maybe a fair assumption to make that they might not have heard about this, as opposed to, getting that reach out too many times. And I think the next slide leads us into the conversation on the toolkit, but I wanted to kind of, before I go into that, see if there's any questions, or Scott, if you had anything you wanted to add on that.
Dawn, I don't think so, but well, no, I think what I would want to add is just the additional context is that there is a method to the meetings, to the planning process, to the data acquisition. And so the surveys that the qualitative and quantitative data from the residents, and the digital equity ecosystem mapping tool is a way that we can get the information. We are required to include a comprehensive statewide inventory of assets in our digital equity plan that identifies who among the state is currently working in digital equity or would like to be a partner in the digital equity implementation process. And so it's a way for us to gather that information. So just to use an example, like ITUB, the work that you're doing, we would want you to capture that in the digital equity ecosystem mapping tool. And the box at the end would be the place that we would, recommend that entities would include, like the recommendation report from the boot camp. And to LCHC, definitely, similar with you guys, we would love for you guys, if you haven't already, to fill that out. And then with the reports that you put in the chat, to be able to link those to that, so we can aggregate all of the information for the state, and that those are additional inputs that we pull through as we draft the digital equity plan.
Awesome. And so in assistance to you, we have created a series of toolkits and a series of pre-made products. And so, Mel, if we can actually pull the toolkit up, I can show you some really great examples. And let's start with the survey. Oh, I'm sorry, if you can go back one more level. Absolutely, yeah, right there. So that second one, what? Yes. So right here, you can see we have a whole Google Drive full of invitation letters, printable flyers, social media, why, you might get some questions from, CBOs that you reach out to, encouraging them to to share the public survey with their community. Documentation in here about why that's important and the role all that data will play in the state digital equity plan. It gives some ideas on how you can engage, again, social media templates. So if you want to post something to your LinkedIn, to your Twitter, to your Instagram, maybe you're having a device distribution event or a digital skills training session and you want to have, the QR code set out or flyers to hand out. All of that is available right in here. And if you're having any difficulty, any part of the staff would be more than happy to assist. And all of this will be shared afterwards and is probably will be shared in the chat if it hasn't been already. And then moving on to the DEEM toolkit, if we want to go one up, awesome. The one that I find the most powerful is that DEEM survey instructions. And so, yeah, Mel, if you want to bring that up. This is basically a guide to all the questions that you can see. So, section 2 here talks about device distribution. So as part of your services or a program that you have, you provide devices, it'll say, these are the questions we really want to hear from you in terms of your your success around device distribution. How many have you distributed? What are your goals for this year? And so you can, I recommend that you look at this before proceeding. It'll allow you to have all those questions answered and then, 10 minutes and all of it that is uploaded into the system and we've received it all. So again, all of these toolkits are available online, free and available for you to use and encouraged. A lot of them contain the QR code, which make it easy for everybody to access. But again, we will be sharing all of these resources. And if there's any questions, happy to answer them. But if not, can pass it back to you, Anne.
Thanks so much, Sean. Let's see. Now, can we have the slides of the upcoming state digital equity events? One more, and then we'll come back to this. Awesome. You've heard that I've been saying this is the last of our health outcome area working group, but just wanted you to know that it won't be the last time we have the opportunity to work together. And so I wanted to highlight the 2 upcoming statewide digital planning group meetings on Wednesday, July 26th, and then Wednesday, October 25th. Both are noon to 2 p.m. And all of our links will be posted at the bit.ly link below, and then we'll also drop it in the chat for you. Today, this afternoon, we will have our essential services, accessibility, and civic engagement outcome area working group. And then our tribal collaboration outcome area working group meeting will be rescheduled later in July. So we'll announce that as well. And now let's go back one more slide. In regarding to tribal collaboration, we are working with PUCs on hosting tribal consultations, which are invite only and specifically for tribal leaders, members, and representatives. So there are 3 in person and 1 virtual. And so if you are working with tribal leaders and members and believe that they should have awareness for these events, please let us know and we'll connect with them directly. You can connect us with them via digitalequity@state.ca.gov. We want to make sure their information is passed along and they can decide which of the 3 or the virtual ones they would like to participate in. Next 2 slides. Perfect. And so just a recap of everything we discussed here, our priority right now is to make sure that we are getting our public survey to residents of California households. So please help us distribute that. We can only get there with your help. And we are happy to support in any way if you have any challenges or concerns, or, you know, how do I use toolkit, or we'll be happy to connect and walk through that. The next priority is the DEAM tool. And then just so you know too, in later this summer, after we are able to aggregate responses from both surveys, tools, as well as from our in-person workshop online working group, we'll be able to draft the statewide digital equity plan and have that for open public comment later in the summer. So please, you know, stay in touch with us, and we would love to hear what you think in that draft. So those are a few next steps and how to stay involved. So know that this is not the last time we'll be working together. So a few contact information before you drop off: digitalequity@state.ca.gov for all SDEP related questions. That's my name, as well as my colleagues at in the office. And Scott, would you like to add any last conclusion remarks?
No, just very thankful and for all the time and effort that folks have put in all parts of the process, but how generous folks have been with their subject matter expertise and lived experience. Your not just but your participation, but your like substantive input, I think is really putting the state of California and the residents in a good place, that we're going to have an excellent digital equity plan to address the needs. So again, thank you, and we look forward to seeing you and continuing this on during the implementation phase.
Thank you so much. Thank you all for your time.
Thank you.
Thank you for the great presentations. Thanks.
Thank you.